Hello, it's Miss Nikki with Stone Academy, and I'm going to show you the measurement scale for urine output. So let's get started. All right, so here are my supplies down here, but first let me show you something. We have a measurement scale form that Prometric will make you sign first, and it's kind of a reminder not to forget to put your cc's on here and your measurements on here before you finish. And don't forget, you got to put the time and you got to put your initials. So that's kind of a reminder. So we're going to do that when we're done. All right. I also want to show you the graduate cylinder. So with the graduate cylinder, it's got two different measurement sides here. And graduate means going upwards. So it graduates in numbers, right? So we've got cc's on one side, we got ounces on the other side. So let's just say it's in 25 cc increments. Let's just count, all right? So we've got 100 here. The next line would be 125, next line 150, next line 175, and then you go to 200. But what if you have urine that's kind of in the middle of 100 and 125? Well, you want to round up so that measurement would actually be 125, okay? All right, so let's get started with, first I'm going to put my gloves on, because with urine, you have to wear gloves. It's a bodily fluid. Any kind of bodily fluid like blood or urine, you need to wear your gloves. That's just standard precautions. If you feel like you're going to get any splashing, you need to use a face guard. All right, so here is my urine bag. We do not want to measure in the urine bag because it's flimsy, it's not stable, and you won't get a good result. So we use the graduate cylinder. Down here, I have a couple of paper towels to get the residual, and then I have one alcohol wipe for when I'm done. So we want to make sure that we do not touch the bag with the floor. It should not be touching the floor, and it should not touch the graduate cylinder or the spout. So what I'm going to do is kind of lift it here, and I'm going to release it from its housing, put it inside the graduate cylinder without touching the sides, and I'm going to open it. Now there's so many different urine output bags that you just have to follow the manufacturer's policies on how to open and close and how to use. So on the sides, I usually get all the residual out. I'll just turn it this way and that way, and then manipulate all the urine out. Okay, so when we're done with that, we're gonna wipe it with an alcohol pad. So I'm just gonna put this to the side. Normally they don't test anything from the bag, but just think if you did have to test alcohol or alcohol content, then you don't want to place that right over that bag. All right, so what I did was close the little spigot area, and then I put this right back in its housing. It's nice and clean. And what we're going to do now is pick up all of our items, because we can be done with the floor right now. I'm going to put this in the dry. I'm going to put this trash in the trash. Then you're going to get a fresh napkin and put it on a flat surface. You want to put this graduate cylinder on a flat surface. Okay, and then you want to look at it at eye level. You can't look up at it because you're going to get the wrong measurement. So you want to bend your knees and look at it with glasses on if you need them, like Miss Nikki. And I see 250, and then there's another line that it's on. It's not in between a number or anything. So what's after 250 if we're doing 25 cc increments? If you said 275, you got it right. And let me kind of show you. I'm going to bring it closer to the camera. Try to keep it on a flat surface as much as I can, but as you can see, it's about 250 right there. Okay, all right, so what do we do now? Now that we know what it is, I like to tell my students, keep that in your head. 275, 275. Repeat it over and over. Okay, then we're going to get rid of the urine and put it in the portable potty. And you want to pour away from you, and you don't want to touch the cylinder with the toilet or you get cross-contamination. Then you're going to use your water. And I get just about enough water as I had in there originally and kind of swish it around. And then again, pour away from me. I get a paper towel, a fresh paper towel, and I dry this out thoroughly, because again, we don't want to leave water and moisture in something that will cause bacteria. I put this back where I got it in the bedside table, and then before I touch my pen or do anything else or touch anything else, I'm going to take off my gloves. Remember that? So we quack, bring it off, and then the other glove eats it inside out. And where do we pull our gloves off it again? If you said up here, then you got it right, off the fingers. We're gonna put those in the trash. And what do we do immediately? After we take off gloves, we wash our hands, exactly. Now, remember, we already signed our measurement form, but it says here, output, time, and type. It says urine, emesis, or diarrhea. Well, we just returned urine, right? So we just measured urine, and so we want to put that there, and then it says mLs or cc's. So Prometric doesn't care whether you put cc's or mLs there, because you know mLs and cc's are equivalent. And then you want to put your initials. So what do I have? I look at the real time. It is 1:18, and you can use just regular time or military time is fine. You write urine, you put 275 cc's, and then they want your initials. And that's what it's going to look like with a regular pen, of course. All right, after you're done with that, you leave this here for the examiner. Remember, you have your other documentation that you want to look at again, wash your hands, and then say your skill is complete.